Are we live? You are not audible.
Sir, we are live.
Yeah, okay. Good evening. This is Chandra Mohan, Ortho and Sports Physiotherapist from Sri Samraj Physiotherapy Center. A warm welcome to ExRxIndia and Sri Samraj Health Services Private Limited presenting for the students, by the students. ExRxIndia's 120th topic is General Principles of Exercise Prescription. Will be presented by Ms. D.M. Mounnika from Wales University. I welcome ExRxIndia pillars, Dr. Rupesh and Professor Duna. Now I welcome our resource person, Ms. D.M. Mounnika, and I request her to present her topic, please.
Shall I start? Shall I start?
Yes, ma'am. Share your screen and then start.
Okay. Is my screen visible?
It's yet to start. Yeah, now
Open the
it's
PowerPoint
visible.
presentation.
Is my screen?
Go to full screen.
Yeah, I have opened. I have opened.
Sure.
Yeah, I have done.
Please continue.
Okay, ma'am. Shall I start?
Yes, please start.
Good evening, all. A warm welcome to all the participants of ExRxIndia. Myself, DM Mounnika, completed my physiotherapy final year. So today's topic of discussion is general principles of exercise prescription. We are going to cover the components of exercise training session, FIT VPP principle, methods of prescribing intensity, measurement of VO2 max, exercise prescription for aerobic training, exercise prescription for resistance training, how to find out 1RM, and finally my reference. So here comes the components of exercise training session. The essential components of exercise training session are warm-up, conditioning, and cool-down. So warm-up. So warm-up is usually done before the exercise session. It should be done for at least 5 to 10 minutes of light to moderate intensity of cardiorespiratory and muscular endurance. So the benefits of warm-up include, it prepares our body for the exercise session. It activates the cardiovascular system by raising the body temperature and increasing the blood flow to muscles. It reduces the muscle soreness and it also lessens the risk of injury. This is all about warm-up. Next comes the conditioning. The conditioning phase should be done for at least 20 to 60 minutes a day. The conditioning phase it may be of aerobic exercises, resistance exercises, neuromotor exercise, or some sports specific activities. Next comes the cool down. So cool down is done after the exercise session. It should be done for at least 5 to 10 minutes of light to moderate intensity, cardiorespiratory and muscular endurance activities. So the benefits of cool down include, it relaxes the body, it helps in recovery of pre-exercise heart rate and blood pressure, it prevents immediate post-workout muscle spasm and cramping. Next comes the stretching. So stretching should be done for at least 10 minutes. It can be done either in warm-up session or in cool-down session. So stretching helps in improving the overall flexibility of the body, and it also helps in preventing muscle soreness because stretching helps in elimination of lactic acid accumulation in the body. So thus it can help in preventing muscle soreness. Next comes the principles of exercises. So we are going to see about FIT VPP principle. The first one is frequency. So frequency describes how many days of a week you are performing an exercise. That is about frequency. Next comes the intensity. The intensity is how intense are your exercise session. So intensity can be described in terms of heart rate reserve, VO2 reserve, heart rate, VO2, that is metabolic equivalent, and even 1RM. We are going to discuss much about intensity in the upcoming slides. Next comes the time. So this describes how much duration of exercises you are doing a day. Next comes the type. So type means what type of exercise you are doing. It may be aerobic or anaerobic or resistance or some neuromotor exercise or some sports specific activity. That depends on your interest. Next comes the volume. So volume describes about the number of sets and number of repetitions per set you are doing exercise. Next comes the pattern. So pattern explains about in which pattern you are doing the exercise. The pattern may be continuous session, interval training, circuit training, and circuit interval training. So first comes the continuous training. In continuous training, you are going to perform the exercise continuously without any break. That is known as continuous training. Next one is interval training. In this case of interval training, A period of exercise followed by a period of rest session will be there. That is the interval training. Next comes the circuit training. In circuit training, there will be 4 to 5 exercises. After the completion of last exercise, again you will start with the first exercise. So you will be doing exercise in a cyclic manner. That is known as circuit training. Next comes the circuit interval training. Circuit interval training is the combination of circuit training and interval training. Next comes the progression. So progression can be done in terms of increasing the repetition, increasing the sets, or else increasing the intensity also. For example, consider you are doing 3 sets with 10 repetition. At one stage of life, your body gets accustomed to the 3 sets and 10 repetitions. At that point, you can increase the progression. This is all about progression and principles of exercises. Next comes the methods of prescribing intensity. So we are going about heart rate reserve, VO2 reserve, heart rate. Here comes the heart rate reserve method, HRR method. So HRR, heart rate reserve, is basically the difference between the HR max and HR rest. So the formula for HRR method is HR max minus HR rest multiplied by percentage of intensity desired plus HR rest. HR max is the highest number of beats per minute that your heart can pump under maximum stress. So that is HR max. The formula for HR max is 220 minus age. So consider if your age is going to be 20, then your HR max will be 200 beats per minute. Next comes the HR rest. HR rest is the number of beats per minute that your heart can pump under rest. So this is the HR rest. Next comes the VO2R method, that is VO2 reserve method. VO2 reserve is difference between the VO2 max and VO2 rest. The formula for VO2 method is VO2 max minus VO2 rest multiplied by percentage of intensity desired plus VO2 rest. VO2 max is the maximum rate of oxygen that you are consumed during an incremental exercises. In the next coming slides, I will explain how to determine the VO2 max. VO2 rest is the oxygen consumption at rest, which is equal to 3.5 ml per kg per minute. This value may vary according to age and gender. Here I have mentioned the normal average value, that is 3.5 ml per kg per minute. Next comes the HR method. The formula for this is HR max multiplied by percentage of intensity desired. So the formula for finding HR max is 220 minus age, as I have already mentioned before. Next comes the VO2 method. The formula for this method is VO2 max multiplied by percentage of intensity desired. Next comes the MET method. MET means metabolic equivalent. The formula for this is VO2 max divided by 3.5 ml per kg per minute multiplied by percentage of intensity desired. So this is all about the methods of prescribing intensity. Here comes a case scenario so that you can understand better about these formulas. A man of 45 years of age is prescribed for exercises with 70 to 80% of HR. So here the formula for target heart rate is HR max multiplied by desired intensity. So first we are going to find the HR max. The formula for HR max is 220 minus age. So in our case, the age of the person is 45 years. So 220 minus 45, which is equal to 175 beats per minute. Next comes the determination of upper limit and lower limit. So upper limit HR max multiplied by percentage of desired intensity. So 175 multiplied by 70%, that is 0.70, which is equal to 123 beats per minute. Next comes the lower limit, 175 divided by 8 multiplied by 80%, which is 0.80, which is equal to 140 beats per minute. So the target heart rate for this case is 120 beats per minute to 140 beats per minute. So like this, you can make use of all the other formulas I have mentioned before. So while prescribing intensity, always you have to find out the range and not a particular value. Next comes the measurement of VO2 max. So VO2 max is the maximum rate of oxygen consumption during incremental exercises. It is measured in ml per kg per minute. VO2 max can be estimated through direct and indirect method. I'm going to explain you the both. First comes the direct method. So direct method is done with sophisticated instruments and it is done in a lab. Here you can see a picture. This is a lab where VO2 max is determined. So here you can see a treadmill, a cycle ergometer, and a computer system and all other software required. So next slide. Here you can see a treadmill and a cycle ergometer. VO2 max can be determined either in a treadmill or in a cycle. So consider if a cyclist comes to you for determination of VO2 max, he prefers a cycle rather than a treadmill. So the selection depends on the client's comfort. So whether it is a treadmill or cycle ergometer. So before starting the test, 5 to 10 minutes of warm-up should be done either in treadmill or cycle ergometer. After the warm-up session, all other necessary arrangements should be made, like the client should be asked to wear the mask. You can see here blue color mask, and you can see a black color sensor attached to it. This sensor helps in estimation of amount of air you are inhaling and exhaling. That helps in determination of VO2 max at the end. And you can see here a harness is connected to the client. So once the patient has worn the mask, he or she will be unable to talk. So appropriate sign language should be taught by the physiotherapist. For example, in case of if the client is okay and he want to proceed the test, he can show thumbs up symbol. Or else if he is not okay, if he wants to terminate the test, he can show thumbs down symbol. So appropriate sign language should be taught by the physiotherapist. So next comes the test. Before starting the test, all the protocols should be clearly explained to the patient. And before starting, the values such as heart rate, blood pressure, rate of perceived exertion, everything should be noted. And even during every stage, all these parameters should be noted down. Bruce protocol is usually indicated for a treadmill, and Ashton protocol is usually indicated for cycle ergometer. The client can complete as many levels as he can. Next, the test will be terminated accordingly. Here I have mentioned some of the termination criteria. So the first one is subject wants to stop. And next one is maximum exertion level. So if the client reaches 90 to 20 in RPE scale, the test should be terminated. Next comes the failure of heart rate and VO2 to rise with increased workloads, and noticeable change in heart rate rhythm on ECG. And finally, onset of angina, that is chest pain or angina-like symptoms. These are some termination criteria. There are many other, but I have mentioned only very few important points here. So this is all about direct method. So this direct method is not always not possible for us to get out. So here comes some indirect method for determination of VO2 max. So these are all the field tests. So they are 1.5 mile run test, 20-meter shuttle run test, 6-minute walk test, Rockport 1 mile walk test, Cooper 12-minute jog test, Storer maximal bicycle test, and 1 mile jog test. So there are n number of tests for determining this indirect method, but I have mentioned very few tests that has good reliability value. I'm not going to explain much about all these tests, but however, I will give some basic idea about all these tests. So here comes general instruction for all these tests. So before starting the test, the basic details such as age, height, weight, heart rate, blood pressure, and test condition, like whether you are testing for a sports population or a patient, everything should be noted by the physiotherapist. So here comes the 1.5 test. In this, the client is instructed to run for a distance of 1.5 mile, and the therapist has to note down how much time duration the client has taken to complete the distance. Next comes the 20-meter shuttle run test. This test is commonly known as a beep test. So in this test, a 20-meter distance is marked with the help of marking cones. The client is instructed to cover this 20-meter distance for 1 minute. Every 1 minute, he will be getting a beep sound. Once the client hears the beep sound, he has to improve his walking speed. So that is the basic description of this test. The client can complete as many laps as he can. Next comes the 6-minute walk test. In this, the client is instructed to walk for 6 minutes, and the therapist has to determine how much distance the client has covered in a duration of 6 minutes. Next comes the Rockport 1 mile walk test. So in this, the client is instructed to walk for a distance of 1 mile, and the therapist has to determine how much time the client has taken to complete the 1 mile distance. Next comes the Cooper 12-minute jog test. Here, the client is instructed to jog for 12 minutes, and the therapist has to note down how much distance he has covered in 12 minutes. Next comes the Storer maximal bicycle test. It is one of the maximal tests, and it is done in bicycle. Here you can see a protocol that is used for Storer maximal bicycle test. So in this test, for first level, the output of cycle ergometer is 50 watts, and every 1 minute there will be increment in the watts. There will be 15 watts increment in the every 1 minute. The client can complete as many laps as he can. This is about the Storer maximal bicycle test. Next comes the 1 mile jog test. So in this, the client is instructed to jog for 1 mile, and the therapist has to note down how much duration the client has taken to complete the 1 mile. So with all these parameters such as time taken, distance covered, and other parameters like age, height, weight, heart rate, blood pressure, you can substitute this in specific formulas, and you can find the VO2 max of the patient. Here comes the few formulas. So this formula is for 1.5 mile. multiplied by gender should be taken for males or females. Minus 0.0753 multiplied by body weight in pounds. So 1 kg of body weight is equal to 2.24 pounds. Consider your rent is 55 kgs, then 55 into 2.246 will be weight pounds minus 2.767 multiplied by time taken. So this is the formula for 1 mile run test. The reliability of this test is 0.90. And this is my reference for formula. Next comes the Storer maximal bicycle test. So in this, the author has given separate formulas for males and females. In case of males, it is 10.51 multiplied by watts plus 6.35 multiplied by weight in kg minus 10.49 multiplied by age plus 519.3. And when it comes to female, the formula is 9.39 multiplied by watts plus 7.7 multiplied by weight in kg minus 5.88 multiplied by age plus 136. The reliability of this test for males is 0.94 and for females it is 0.93. And this is my reference for this formula. Next comes the 1 mile jog test. Here the formula is 100.5 plus 8.344 multiplied by gender, 1 for male and 0 for female, minus 0.0744 multiplied by weight, minus 1.438 multiplied by mile time, minus 0.1928 multiplied by heart rate. The reliability of this test is 0.87 and this is my reference article for this formula. Next comes the Rockport 1 mile test. Here the formula is 132.853 minus 0.0769 multiplied by weight minus 0.3877 multiplied by age plus 6.315 multiplied by gender. 1 for male and 0 for female. Minus 3.2649 multiplied by mile walk time minus 0.1565 multiplied by ending heart rate. The reliability of this test is 0.88 and these two are the references for this formula. Next comes the exercise prescription for aerobic exercises. So aerobic exercises may include activities such as cycling, swimming, walking, running, skipping, and etc. The protocol here I have mentioned is indicated only for normal, healthy individual adults without any comorbidities such as diabetes mellitus, hypertension, CKD, and etc. So here comes the protocol. Frequency. In case of moderate intensity of exercises, 5 days per week is recommended, and in case of vigorous intensity exercises, 3 days per week is recommended. Next comes the intensity. In case of moderate, it is 40 to 60% of HRR or VO2R, and in case of vigorous intensity, it is 60 to 90% of HRR. Next comes the time. 30 to 60 minutes per day in case of moderate intensity and 20 to 60 minutes per day in case of vigorous intensity. Next comes the type. So the type can be endurance exercises or any recreational activities. Next comes the volume. So volume should be more than or equal to 500,000 met min per week. Next comes the pattern. So it may be a continuous session or multiple session of 10 minutes each. Next comes the progression. So progression is done by increasing the time, frequency, or intensity. The recommended progression is increasing 5 to 10 minutes every week for 1 to 2 weeks. Here comes the exercise prescription for resistance exercises. This protocol is also indicated for normal, healthy individual adults without any comorbidities. Frequency. When frequency is considered, 2 to 3 days per week is recommended. Next comes the intensity. In case of very light to light, 40 to 50% of 1 RM. Light to moderate, it is more than 50% of 1 RM. Then in case of moderate to vigorous, it is 60% to 70% of 1 RM. Then in case of vigorous to very vigorous, it is more than 80% of 1 RM. In the next upcoming slide, I have explained how to determine 1 RM of a person. Next comes the time. So as far as resistance exercise is considered, no specific time duration for effectives has been identified. Next comes the type. It may be a multi-joint exercise or exercises targeting the agonist and antagonist muscle group. Next comes the volume. So volume is for 2 to 4 sets with 8 to 12 repetitions per set. Next comes the pattern. The pattern is 2 to 3 minutes of rest can be given between each set, and a rest of more than 48 hours is recommended for a single muscle group. Next comes the progression. Gradual progression can be done in terms of resistance, repetition, and frequency. This is all about the protocol for resistance exercises. Here comes how to find out 1 RM. 1 RM, that is 1 repetition maximum, refers to maximum amount of weight that you can lift for a given exercises. So in case of upper limb, bench press or shoulder press is used for determination of 1 RM, and in case of lower limb, leg press or leg extension is used for determination of 1 RM. So this picture is bench press and this is leg press. So here comes the protocol for determination of 1 RM. So consider we are checking our 1 RM with bench press here. So before starting the test, always do 5 to 10 free repetitions in bench press. Always start with a weight of 40 to 60% of your perceived maximum. Once you're done with 5 to 10 repetitions, rest for a minute. Then again add some more weight and again do 3 to 5 repetitions and take 1 minute rest. Continue the process until you get a failed attempt. So at the end of the process, the greatest amount of weight you lifted will be considered as your 1 RM. So once you completed the test, you have to note down for the resistance, that is weight, how much kgs, and how many repetitions you have done. So with all these parameters, we can substitute this in a formula and we can find the 1 RM. So here comes the formula for determination of 1 RM. So the authors such as Brzezicki, Epley, Lander, Lombardi, Mahu et al., O'Connor et al., and Watson. So all the authors have given different formulas. So Brzezicki has given 1 RM is equal to 100 multiplied by rep weight divided by 1.2.78 minus 2.78 multiplied by reps. And Epley has given 1 RM is equal to 1.0333 multiplied by reps multiplied by repetition weight. And accordingly, all the authors has also given. So to describe 1 RM more precisely, there are different formulas available for different exercises. Like bench press has different formula, leg press has different formula, lateral pull down has different formula. So here I have mentioned formulas only for 1 RM, but the formulas for 3 RM, 6 RM may differ accordingly. But here I have included the general formula and exclusively for 1 RM I have mentioned. So this is all about the 1 RM. And these are all my references. I have to call the exercise protocol from ACSM's guidelines for exercise testing and prescription. This is a 9th edition book, and others are some research-based evidence articles that I have used for this presentation. And thank you for all your attention.
Thank you, Mounnika. Really, I enjoyed it. Everyone thinks that FITT, fit is the right version, but no, fit BPP is the recent trend, the principles. Okay, thank you for enlightening us with such a kind of principles which we were thinking fit only. Volume, pattern, and progression has been recently added into it.
Yeah.
And,
thank you so much. I would like to thank Dr. Chandramohan sir, Dr. Rupesh sir, and Professor Dona ma'am for providing me such an opportunity to present my topic in this. And the special mention to my HOD sir, Dr. P. Sendil Selvam sir, and my guide, mentor, and my well-wisher, Dr. V.K. Jayasilan sir. And special thanks to my parents for their tireless encouragement and support. Thank you.
We would like to thank Dr. Sendil Selvan sir also, and all other professors who support their students to contribute and present their topic in ExRxIndia's For the Students, By the Students web series. And I thank all the participants. We will move on to the next topic. Bye-bye.